Are you about to have a baby? Here's some of the hard questions that you guys should talk about before you get to the hospital. We'll call this your birth plan. Something that you should know, you should have printed out, a hard copy to give to your nurses and your doctors when you get to the hospital so they know and you know what your wife's expectations are and how she would like this to go. Is she gonna want an epidural or not? If she doesn't, does she want the doctors to let her know when her last opportunity is to get one? Are you gonna vaccinate your baby? If you are, which ones? All of them? Or one or two? Vitamin K? What about the cream on the baby's eyes? Are you gonna accept everything? Just a few? None? This should be written down. After the baby's born, the baby needs to eat. Your wife's breast milk supply most likely won't have come in yet. Do you wanna use donor breast milk or allow the hospital to give you baby formula? If you're having a boy, do you want him circumcised or not? What do you guys plan to do with the placenta after you leave the hospital? Do you, as the dad, want to help pull the baby out or catch the baby? Do you want to do delayed cord clamping? And if so, how long do you want to wait? If you end up with a C-section, do you want to see everything or do you want them to put the cover up so that you don't see anything? These are the main things that were on our birth plan. The biggest thing is that you have it written down so that you know and you don't have to ask her. Your doctors know and your nurses know what she expects. She's the one going through this experience, so we need to respect her wishes. This way, when you have your birth plan printed out and you get put into a situation where you need to make a decision in an environment and situation that is extremely stressful, even for the dad, because you're sitting there helpless and there's not a whole lot that you can do, you can refer back to the birth plan that you've printed out and handed to everybody and know what she wants and how to make these decisions.